At the onset, I will like to thank organizers for giving this me opportunity. This is the most controversial topic, vitamin D and diabetes. Because why I say controversial? There is no fixed range what should be the vitamin D levels. There is no fixed dose what should be the dose which is to be given in deficient patients. And there are different studies which have been published. Some studies favor of vitamin D supplementation. Some says it is of no use in giving diabetes. Mainly I am going to focus here on vitamin D and its role in diabetes. Basically there was one study which was published in 2010 in Canada, where they were studied and they said most of the patients in Canada, they are deficient in vitamin D. And if you supplement these patients with vitamin D and maintain their levels at normal, then you will be reducing a health budget by 45 to 60%. So you see the huge problem of vitamin D deficiency. It was in the United States, it was seen that almost more than 90% of the patients who have been investigated and who are of more than 70 years of age, they are suffering from vitamin D deficiency. Why I am saying like this is because the vitamin D is affecting at least 3,000 genomes out of 30,000 genomes which are responsible for different disorders. Vitamin D is not only responsible, as in our early days it was said that it was mainly an anti-rickets drug, but nowadays it has been said that it is useful or it is to be maintained at normal levels to prevent so many chronic diseases including diabetes, mainly heart disease, maybe immunocompromised diseases, maybe hypertension, maybe cardiovascular failure. In such type of patients, it is advisable to supplement vitamin D in such type of patients. Basically, I am going to give certain studies, I am going to discuss certain studies which are in favor of vitamin D. So, vitamin D has come in pictures, it has been discussed since last 7-8 years in our country. But in electronic and print media, it was discussed in around 2001. Where BBC also has reported that if patients are having vitamin D deficiency, they are more prone to develop diabetes. It was published in Times article and Daily Mail in 2008, the importance of vitamin D in preventing diabetes. And it is said that one vitamin that can save your life. So this is a vitamin D. As all of us know that vitamin D has been traditionally known as anti-rickets drug. It is a factor of sunshine vitamin. It is the only vitamin synthesized by the body and it functions as a hormone. It is a secosteroid. What is a secosteroid? Secosteroid means where one of the rings of steroid has been cut and it is a hormone which is acting on the body. It has got an important role in calcium homeostasis which has been discussed long since our college days. But nowadays it has its importance in chronic disorders like diabetes, hypertension, myopathic disorders and autoimmune disorders and cancer has been come into light. How vitamin D is synthesized in the body? This is the important is vitamin D metabolism. As you skin come in contact with sunlight, dehydrocholesterol is released from the skin. It is converted into the cholecalciferol. Then it is metabolized in the liver and kidneys and it is available in the circulation in the form of vitamin D3, that is 1,25-dihydroxyvitamin, which is responsible for the different aspects or different clinical disorders where if this is a deficient, you may get different clinical disorders. Only sunshine is not the source of vitamin D. It has got a fish, is one of the best source of vitamin D. Then there are dietary supplements which also are there. In cases of patients who are deficient vitamin D, they can be supplied. What are the functions of vitamin D? Vitamin D, as already I have discussed, it is metabolized in the liver and kidneys. Once it is metabolized in the liver by alpha hydroxylase, it gets converted into 25-hydroxy-D, which goes into the circulation in kidneys, macrophages, prostate gland, and it has got different actions at the different levels after getting converted into the 125-hydroxy-D. It has got a main role in calcium homeostasis, muscle health, bone mineral metabolism, immunomodulation and regulation of cell growth and differentiation. So as already I have discussed, there are different issues about the normal levels of vitamin D. But the consensus is that if the vitamin D level is less than 10 nanograms per ml, it should be said that it is a vitamin D deficient. But there was a recent study which was published in 2014, and it has been said that minimum level of vitamin D in your body should be 26 nanograms per ml. Below that, if vitamin D deficient people are likely to develop diabetes. So, and there was another study which has said that you should have vitamin D level not less than 20. Means 20 level was also accepted. In our clinical practice, in day-to-day practice, it is very difficult to achieve the levels. In Indian scenario, as all of us know that, there was one study which has been published few days back by SRL laboratories, and it has been said that 70 to 80% of the Indian people are deficient in vitamin D. It is like Western countries. Even if we are staying in this below 35-degree latitude, still we are suffering from vitamin D deficiency. But exact levels, exact range, and exact doses, there is no consensus on this. There are different. Somebody says that Mayo Clinic has recommended 600 to 800 units. On the contrary, somebody has recommended 8,000 units per day. So this is the vitamin D Council, which has recommended 5,000 international units per day. So there are different doses which has been recommended by different bodies, and the main daily source of vitamin, patient should take at least 1,000 international units per day is advisable in Indian scenario. So that patient can, suppose patient has got 30 nanograms of per ml vitamin D levels, to raise its levels up to 40, he should get at least 1,000 international units of vitamin D per day till the time he achieves 40 nanograms per ml. So that, and he has to maintain that level, you have to continue with the vitamin D supplements. How many days it is to be continued? It is said that it is lifelong. So you have to supplement vitamin D for lifelong also. As far as the latitude is concerned, people who are staying above 35-degree latitude, the sun rays which are coming, they are absorbed by the ozone layer. So these people don't get sunlight, and these people are more deficient in vitamin D. Still in India, even if we are below 22-degree latitude, we are also still suffering from vitamin D deficiency. In spite of the having, we have got good sunlight, good sun exposure. But if we study, as I mentioned, it is more than 70% of the people who has got vitamin D deficiency. This is an Indian study which was conducted in Delhi. It is conducted in school-going children. Here, if you see here, you see almost all the people, all the boys, he has got vitamin D levels less than 25. But here, if those big boys who have got more than 20, we did not treat them, or we have to see that we could achieve their levels more than 25. There are different criteria. If the patient are symptomatic, it is even used to prevent the diseases. Then there is another study in the age group of 20 to 45 years of age group, where there is the people who are staying in urban and rural area. They have been studied. Here also, if you compare, here also the people are deficient in vitamin D. No one has got a vitamin D levels more than 30. And it is said that you should have levels more than 30 nanograms per ml. This is a vitamin D deficiency is a syndrome. It is the tip of the iceberg, and most of the times it is mainly associated with the diabetes and so many disorders, including heart attacks, high blood pressure, then bone fractures, breast cancer, and all these things. Low vitamin D is a potential risk factor for chronic disorders, including diabetes mellitus, metabolic syndrome, obesity, hypertension, and congestive heart failure. As prevalence of diabetes, as International Diabetes Federation figure is more than 70 lakhs of people, more than 70 million people are suffering from diabetes in India. And what is the role of vitamin D in type 2 diabetes? How does it act? It is mainly when it is 125 hydroxy D3 is in the blood, it acts on the pancreatic cells and it stimulates the insulin secretion and induces insulin synthesis. Insulin secretion and synthesis, once it is stimulated, it causes increased levels of insulin and it reduces the blood sugar levels. So it has got actions at different levels also including bone, gut, It helps in absorption of calcium and phosphorus in gut and bone, and it has got deep actions on kidneys, parathyroid glands, and immune cells as well. What are the factors responsible for low vitamin D levels in the diabetes? It is mainly restricted intake of vitamin D, less sun exposure, obesity. More vitamin D is stored in the fatty tissues and less in biologically active in the form. So these fatty individuals are more prone to have vitamin D deficiency. Then patients who have renal insufficiency and genetic variations. What are the other sources other than sunshine? Vitamin D is fish. Mainly a fish is the main source of vitamin D. Then fortified foods like breakfast cereals, orange juice, mushrooms, milk and milk products, meat and eggs. Almost these products, they contain 200 to 300 international units of vitamin D. Why it is not working? There are different studies which show the incidence of vitamin levels of vitamin D and development of diabetes. There are a number of studies show relationship between vitamin D and diabetes, but with very different mechanisms for type 1, type 2 diabetes. As type 1 diabetes, it is more, we know that it is autoimmune disorder, and type 2 diabetes may be related to the insulin resistance. This was a Finland survey carried out, mini Finland health survey to study the vitamin D deficiency and risk of type 2 diabetes. And it has been found that there is inverse correlation between the diabetes and vitamin D levels. There is another study where it has been found that plasma 25-hydroxy vitamin D concentration and risk of incidence of type 2 diabetes in women. This study was carried out in almost 608 patients who have received 25-hydroxy D, and the patients who were newly diagnosed type 2 patients, and those 558 patients were control subjects, and this was a nurses' health study. And here it has been shown that the people who have got plasma 25-hydroxy D concentration was inversely associated with development of type 2 diabetes. Means lower the level of vitamin D level, higher the chances of the patient getting diabetes. What is the association between the vitamin D and status of prevalence of diabetes? It has been shown that vitamin D has got a direct effect on the beta cells of the pancreas, thereby it stimulates the release of insulin and it stimulates the release of secretion also of insulin. It is through vitamin D receptors which are there on beta cells of the pancreas. Activation of vitamin D occurs within the beta cells by the 1-alpha hydroxylase enzyme, and vitamin D directly stimulates the expression of insulin receptors and enhances insulin action, and it suppresses the cytokines. What are its indirect effects? It has got indirect effect on the regulation of extracellular calcium influx through the beta cells, and it improves insulin secretion through that. And there is a suppression of parathyroid hormone which causes decreased insulin resistance. Effect of vitamin D on beta cell function and insulin secretion, as already I have discussed, that 125-hydroxy D acts at the beta cells of the pancreas here, and through its receptors causes release of insulin synthesis and improves insulin secretion. This study was published in 2008, where it has been shown that vitamin D deficiency and insulin resistance. The patients who are deficient in vitamin D, they have got more insulin resistance, and the chances of development of diabetes are very high. Here it has been shown that in this graph, the people who has got more vitamin D levels more than 30 has got low levels of HOMA-IR, insulin resistance levels. It is vitamin D and insulin resistance. AMP kinase of metformin, it improves the glucogenesis and fatty acid oxidation. Vitamin D is positively associated with adiponectin and negatively with HOMA-IR, so that is insulin resistance. What is the mechanism of development of diabetes? It is mainly because of increased parathyroid hormone. There is vitamin D deficiency which causes insulin resistance, then beta cell dysfunction, and causing diabetes and metabolic syndrome. Really, vitamin D supplementation improves the patients with diabetes. There is one study which has been published, just I discussed a few days back. It was in 2014. One study was published that even if you supplement vitamin D in some patients who are genetically prone to develop diabetes, it may not be of any use. But there are so many studies which are in favor of supplementation of vitamin D in such type of patients. This was a study of nurses' health study where there is a 20-year follow-up and almost 18,000 women were studied, and combined daily intake of more than 12,000 milligram calcium and 800 international units of vitamin D was compared with 600 milligram calcium and 400 international units of vitamin D, and it has been shown that there was 33% reduction in risk of diabetes. This is another study to find out the effect of oral vitamin D and calcium replacement on glycemic control in South Asian patients with type 2 diabetes. It has been shown that post-treatment, all patients with vitamin D were normalized it has been shown that it has been found that almost HbA1c reduction of 0.7% those patients who achieved HbA1c vitamin D level to the normal level. So there is a reduction of HbA1c after supplementation of vitamin D. Study showed that vitamin D and calcium replacement therapy in South Asian patients with type 2 diabetes causes a significant increase in both HbA1c and weight, which may be attributed to the increase in vitamin D levels after the treatment. This was another study which was for vitamin D supplementation reduces insulin resistance, which already has been discussed. This was a randomized control trial on 235 patients where it has been seen that 25-hydroxy levels were increased after giving supplementation of vitamin D. It is improved from 8 to 32 nanograms, and there was significant improvements in insulin sensitivity and insulin resistance. Improving vitamin D status in insulin-resistant women. This was a study published in where it has shown that optimal vitamin D concentration for reducing insulin resistance was 32 to 47. As already said that there are different studies which has conveyed different levels of vitamin D levels. Vitamin D and insulin sensitivity. Highest vitamin D levels associated with 60% improvement in insulin sensitivity. Improving vitamin D status in insulin-resistant women resulted in improved insulin resistance. This was optimal vitamin D concentration for reducing insulin resistance was 32 to 47. Highest vitamin D levels are associated with 60% insulin sensitivity. You have to supplement along with. What are the benefits of the vitamin D? It is above this glycemic control. Mainly it has got a pleiotropic effects on diabetic retinopathy. Then it has got a pleiotropic, means it has got a the patients, even in diabetic neuropathy, it has got a favorable effects. That means vitamin D supplementation significantly reduces the neuropathic pain. Then nephropathy is also reduced with vitamin D if you have got normal levels of vitamin D. And already we know that vitamin D helps in bone health and it reduces the fractures and maintains the bone health. What is the clinical evidence of vitamin D? Vitamin D supplementation in pre-diabetes reduces the progression of type 2 diabetes and was associated with decreased insulin resistance and systemic inflammation. This was a study carried out in Eastern India. Vitamin D supplementation along with supplementation as an adjuvant therapy for patients with type 2 diabetes. Then 18-month prospective interventional study. Effects of vitamin D3 supplementation on the metabolic profile was studied in Saudi patients of type 2 diabetes, and it has shown that vitamin D supplementation in these patients has shown significant improvement in diabetic status. Here you can see the comparative. Vitamin D supplementation significantly improved the lipid profile, favorable change in HDL and LDL ratio, and HOMA-B function. Role of vitamin D in insulin resistance we already have discussed. These are the different studies which has shown that there was if the vitamin D levels are normal or above normal, it improves in insulin resistance in all type of patients. Already this has been discussed. What is the problem with this? This is the vitamin D and resistance. These are the different studies. How to treat the patients with vitamin D? Already I have discussed that you should supplement vitamin D at least 1000 international units every day to raise the vitamin D level by 10 nanograms per ml, at least for 6 months, and you have to till the time you achieve the normal levels of vitamin D. And it has been said that it is not vitamin D levels in different persons differ depending on its race, depending on its exposure to sunlight, and depending on other things. So different regimes already have. So it's not working. Okay. Thank you.